listening to Planet Vero Radio. I am Cindy Schwartz, and this is the Patient Partner Show. We are broadcast on iHeartMedia. We are also podcast on Spreaker. I've got my co-host Jeannie Roller on Skype with me. She's in Indiana. Today we're talking about different ways that you can maybe get more positive interaction, more positive care, because we do talk a lot about what the harm has been done to patients, and you really don't know what to do. You have to go to the medical community. Not a lot of us can do our own surgeries and do our own things, and, that's not to be funny, but it's true. And when things do go wrong or go awry, you are afraid to go back to the same place where it happened, certainly. Or what do you really do? Sometimes you get mad. I mean, I've gotten mad when I couldn't figure it out, and I'm like, well, I don't even understand how people in the medical community do treat people like this. So I want to talk a couple of things that I heard on from doctors that make sense, and they realize it too, that nobody is infallible, that the medical community isn't 100% what maybe you think it should be or what's good for you. You might want to have a different opinion or whatever. So that's what this one doctor told me. He said, if you go into a doctor's office and you've done a little bit of research, or the doctor was recommended to you by a friend or so and so, or you know of it from a particular procedure or something like that, that's why you went to him or her. And maybe it doesn't sound like it's what you would want to do, or the treatment plan, or you've heard things that are different. Go ahead and ask the doctor if that treatment plan, if that procedure and all of that is actually based on fact, or if it's based on his or her opinion. Now, of course, we know there's no 100% in medicine. We know that. But there are statistics that say, well, this procedure has been successful 40% of the time given so-and-so and so-and-so. So there are some facts about that. And the other thing this same doctor said, if you go to a certain doctor and that doctor seems to be very aloof, or some of them can have a little bit of ego or a lot of ego, and surgeons kind of get the bad rap on that, and they don't really want to give you information up front of contact information, and they're not really answering the kind of questions that you want to have answered, and they just seem to be not like jiving with you. Go to and get another opinion. Get a second, a third opinion, and also know that those things aren't going to change. If that doctor is that way from the beginning, 90% of the time, 99% of the time, that isn't going to change. That's going to be the demeanor. That's going to be kind of the navigation all along. So it will be frustrating for you, and maybe you want to seek somewhere else. So I just want to throw some of those things out. Jeannie Roller, maybe you have some other things that you found that work for you. I know I have, and I know that asking more questions sometimes is not the best thing, but again, given that particular doctor, that particular staff, and then other times it's worked out beautifully. So we are kind of working with kid gloves, if you will, sometimes.
Well, right. And if you have a doctor or a doctor's office that doesn't like to answer questions, it probably is a good idea to go elsewhere. That is my opinion, because they're not maybe giving you all the truths that you need to hear, because a lot of times doctors have certain procedures that they have mastered and they don't do other procedures, so they will only recommend their procedure. So if you're not getting the answers that you need, then do go elsewhere. Make sure that you get copies of your medical records. Read those from time to time. See what is in them. Is it really what you've said to the doctor? You need to read those medical records.
Yeah, and another thing, too, that I didn't mention, it's kind of common knowledge, is not every person, gets along with every other person. It's not either one's fault or blame or anything like that. I mean, we know that just ordinarily. I mean, I'm not trying to make the doctors or the staff the bad guy. Sometimes it's just, you get along better, or you just mesh better with somebody in a certain situation, and that's just the way it is, and there's nothing wrong with it.
Right, and if you have a bad feeling, then it probably is wise to go elsewhere. I can't say that enough.
Mm-hmm.
That you have to go with your gut instinct. If you don't think that it's going to be a good fit, then Your body is so important. By all means, go elsewhere if
Right.
you can.
And there's not anything wrong with that. I mean, emergencies are emergencies. So we're not talking about that. We're talking about elective procedures. We're talking about, if you have a little bit of time. I do know in the cancer field, most times you don't have a lot of time, but you do have a little bit of time. And sometimes even taking that little bit of time, and I'm saying from personal experience, it wouldn't really have mattered another week. And it would have behooved to go a different avenue. So, again, I mean, I'm not a doctor, I'm not a lawyer, but a lot of this stuff is intuition and what you feel is the best for you. And not everyone has the same fit with every other, doctor, nurse, whatever that's in the field.
Right.
So we want to also say, too, in this show that, Jeannie Roller, you have a new website that people can contact. And it is patientrightsinfo.com. And you can also write in, listeners, at info@patientrights.com to ask Jeannie and I a question, ask for advice, ask for, scenarios, whatever. We'll absolutely be helpful to you in any way that we possibly can. We both have navigated a lot of this, and we also have other partners that we are in constant contact with that have navigated this, have been in the fields for quite a long time, trying to help patients that have been harmed, that are nervous to go back into the medical system, if you will, that really don't know what to do, and to stick up for your rights, because we do have rights as patients. We do.
Yes, we do. And our website will be talking about everything for patient rights, the good, the bad, and the ugly. And just give us patience. We're all volunteers, so give us patience. We'll get the information up there.
Yeah. And we talk about all kinds of things. I mean, we have other partners, too. I want to mention Misty Roberts, who's been helping people for quite a long time. Her website is patientmodesty.org, and she talks about different modesty issues and other things. It's not geared towards patient modesty. It's geared towards how we can help patients get a better perspective, a better, health help across the board, because we don't want to see happen what happened to us and the hundreds of people that we've talked with trying to get medical care, and there was no one to ask. There was just no, It was this way or that or leave.
And one thing that Misty is doing with her website is she's offering training to medical providers, which is fantastic.
Okay, so check that out, patientmodesty.org. She's also on Facebook at Medical Patient Modesty as well. And we've also talked with doctors on other shows. We've done previous podcasts talking about surgery garments. That information will be up there. Dr. Bruce Levy, that is in Mayo Clinic, he invented some surgery-specific garments that are used in orthopedic surgery. And there's also another doctor, I'm going to forget his name right now, but he is in the Chicago area, and it was because of one of his workers, actually, that needed a shoulder operation and didn't want to have it because she didn't want to be her breasts exposed during the operation. So his avenue also has invented surgery-specific garments for people, both men and women, to wear for these procedures, because it is viable, it is reality, and it is not necessarily a germ issue. For some organizations, some doctors, some facilities, it is, but there are many, many doctors out there that it is not, and there are choices for people to make. It's not one way or the highway. Jeannie?
Yes. Well, I totally agree. The garments should be offered to all patients. It is a very little cost. Most patients actually would be willing to pay for the cost themselves of the garments, so there is no reason for them not to be offered.
Well, and that, true is you can buy them and bring them with you. All you have to do is have the conversation with the doctor. And again, if you're coming up against these brick walls and they're saying absolutely not, don't do this, it's germs, blah, 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 please rethink it, because we know if these doctors are offering them that it can be done. So I want to say a huge thank you to you again, Jeannie Roller. Please stay tuned to Planet Vero Radio.